This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us this morning. Of course, everyone was talking about coronavirus this week, and Governor Mike DeWine gave an update on the state's efforts to prepare. He and the head of the Ohio Department of Health, Dr. Amy Acton, appeared at Metro Health in Cleveland to give that update. We bring you the remarks of Dr. Acton and Governor DeWine this morning on Columbus Concerns.
After I was elected governor of this state a little over a year ago, I asked Dr. Amy Acton to head our Department of Health. Since the beginning of the news about the coronavirus 6 weeks ago, Dr. Acton and her team at the State Department of Health have been engaged with our local and with our federal partners, preparing for whatever might come next. Dr. Acton updates me at least once, sometimes many times, every single day. She briefed our cabinet this morning again. And she has just returned last night after spending the last several days in Washington, D.C., where she has been working with her counterparts across the country, as well as officials from the Centers for Disease Control and Prevention, the CDC, and the U.S. Department of Health and Human Services, and the White House. The threat of the coronavirus in the United States and in Ohio remains low. And currently in Ohio, we have no confirmed cases. We have no confirmed cases, nor any persons under investigation. We have had 7 people tested for the virus in Ohio, and all of these individuals have tested negative. But we know that this could change, and so we have to be prepared. And all Ohioans must have a sense of urgency about this emerging health threat. And that's what I want to talk about today. It's imperative that we be open with the public and that we communicate information in real time about the coronavirus to both inform and educate the people of the state of Ohio. My commitment is that we will communicate what we know when we know it. That is our obligation, and that is what we intend to do. Certainly today, no one knows all the answers. No one does. Dr. Acton will share today with you what we do know so far, but we certainly cannot predict the future. And this disease continues to evolve, making it all the more important that as things change, we continue to work with our local partners to communicate information to the public. In Ohio, our Department of Health, our State Department of Health, works directly with 113 separate county and city health departments around the state. We work very closely and collaboratively with these local departments. They are truly the first line of defense in every one of our communities. The State Department of Health works with our local partners to provide guidance to them, to provide virus, but also the flu. Because the fact remains that Ohioans today are at a much higher 16,000 flu deaths in the United States so far just this season. And that figure might be as high as 41,000. Flu remains a major killer in this country. While we do not have data about how many adults have died in Ohio from the flu, we do know that there have been nearly 1,200 flu-related hospitalizations as of February 15th. And tragically, 2 children, both young girls here in Northeast Ohio, have died from the flu this season. A 16-year-old in Cuyahoga County and an 11-year-old in Lake County. As I said, the adult numbers in Ohio we do not have. And so as we outline the steps Ohioans can take to protect themselves from a possible coronavirus outbreak, it is equally important to take these very same steps to prevent the spread of the flu that we know is already here. Today, I have asked my cabinet directors to implement several very important steps in their agencies to help mitigate the risk of both the flu and possible coronavirus in Ohio. As a state, I believe that it is important that we lead by example. And so what I'm ordering today, I hope, does that. As far as the state is concerned, we run institutions, buildings, 2 veterans homes, 6 state hospitals, 9 lodges at our state parks. We have 28 state prisons in Ohio. So we have an obligation to ramp up what we are doing and to have that sense of urgency ourselves about what I'm asking all Ohioans to have, and that is that sense of urgency in preparing for what may be coming. So, here are some of the things that I'm ordering today. And I strongly encourage everyone else across the state of Ohio who runs businesses, who runs hospitals, nursing homes, schools, and other facilities, that if you haven't done these things already, to examine your existing disease prevention plans and consider additional measures. Now is a time to review what you're doing. Once again, now is a time for a sense of urgency. I am today directing the Ohio Department of Transportation to post information from our Department of Health in all state rest areas on hand washing protocols and to include messages on Ohio Travel TV. I'm asking our Department of Rehabilitation and Corrections and the Department of Youth Services to increase the frequency of and be very aggressive in the use of disinfectant measures in all their state facilities to protect the inmates, the families, and the staff. I'm calling on our colleges and universities, our college and university leaders, to urge every student, every faculty member, every employee that if they have not yet received a flu shot, to do this immediately. Go to the campus health clinic and get these shots today. Further, I'm asking our college and university leaders to prohibit college-related travel to nations where the CDC has recommended no travel, such as China and South Korea. And for all Ohioans, please consider your foreign travel. Anyone thinking about foreign travel should monitor the CDC's travel advisory website for updates. This is updated every single day, and as this virus continues and what we know about it continues to emerge, this information we can bet will continue to change. Monitor the CDC web page. It's very important to do that. I also am asking our colleges and universities to take appropriate action. That meeting will focus on those things and more. Let me conclude by urging all Ohioans to help. And I know Dr. Acton is going to talk about many things that average Ohioans, all of us in our daily lives can do. But again, the basics. Wash your hands, avoid close contact with someone who is sick, and stay home. Stay home when you are sick. Something that some of us find hard to do, I think. I urge Ohio employers and schools to be flexible if people are sick and encourage people to stay home who work for you. These are simple and effective ways that all Ohioans can help. Let me now, at this point, turn it over to Dr. Amy Acton, who, as I said, has really been immersed in this for the last 6 weeks, and someone who brings in her training and background a great background to lead our efforts in regard to the coronavirus, but also what we do every single day and our departments do every single day in regard to public health. Amy?
Thank you. Thank you, Governor. Thank you. Good afternoon, everyone. You see me a little sleep deprived. As the governor said, I just got back from D.C., where I spent a couple days really at the White House, talking to leaders there, working with the leadership of the CDC, and most importantly, talking to other states. It's wonderful to be here at a place that is, this hospital is so amazing in their work on infectious disease. So at the end, I hope reporters will also take time to learn more about what they do here. But I want you to know that our state stands ready. I know I say that, and I know at a time when there's a lot of information flowing and seemingly changing information, it makes it harder for people, everyday people, just to feel secure in what's happening. But this is something we really are prepared for. Infectious diseases are something we know. And even when there's a new infectious disease, they are predictably unpredictable. In other words, pandemics and spread of infectious disease happens in a phased way, and it happens in patterns. And so we really, while we might not know exactly where it might spread first or where the one case in Ohio might occur, we really know what to do about it when it happens. So I want to let Ohioans know that this system is working. And in fact, in looking around our country, I felt that we are very prepared. We've taken a very conservative, sort of aggressive approach, as is my nature, and we'll tell you more about that, especially in the question answer. I want to answer a lot of details. But I want to think about what this feels like for people at home who might see this or hear about what you write. Again, coronavirus looks very much like the flu. What we now know, and we learn more hour by hour, is that it's very contagious. It's particularly catchy. In terms of its morbidity and disease state, it's a little more dangerous than the flu, but it's not as dangerous as things we've seen in the past, like you have dealt with here, like Ebola or SARS or MERS. It acts like a flu or cold. You have the symptoms of coughing, fever, body aches, and work with these amazing disease detectives, what Terry is going to tell you about here at the local level of global migration and quarantine, and then we share them with the local counties. About 33 counties have had a traveler that we know of, sometimes one, sometimes two. But that number will grow if we see more guidance about travelers from other countries. So that system is working. It's working very well. But if we had a case, we would come to you right away. So what would a case look like? Again, most of the cases in this country are at home. They're being monitored at home very similarly as to the people we suspect. They're not sick enough to be actually in a hospital. Right now, there is one person hospitalized. We know that most people will be miserable and take comfort measures like we do with the flu, but eventually it will pass. When it gets worse, they have respiratory distress most often. Sometimes in other countries, they've been put on a ventilator, and that's where you see people having more severe symptoms. But right now, the disease is really looking a lot like the flu, where you get that spectrum of people, mostly people who do well, but some people who might not. So that's my best way of explaining to you what it will look like when we see a case. Importantly, we surround that case. In a way, we take histories on folks that you wish your doctor still took on you. We ask you everything you have done, what you eat and drink, where you have traveled, if you sat on an airplane, what seat you sat on. We know everyone you have come into contact with. And then we go to those people you have come into contact with, and we talk to them. And some of those folks, like your family members, might be asked to self-quarantine and stay home as well. And we take those rings of knowledge out. Someday there might be a case who went to the movies. in which case we would publicly say that. We would say they were at the movies and saw, Spider-Man number whatever, and they were in this theater, and then people who were worried about that would have that knowledge so that they could go to their healthcare provider. The important thing about all of this is we will learn more hour by hour. And it's most important that you get your information from a good resource. So we have created, in addition to our usual website, we've made a more public-facing version of it called coronavirus.ohio.gov. And we're going to be putting on that lots of tips for just all citizens. Already on our website at odh.ohio.gov, we have tons of guidance for hospitals, businesses, schools, universities, kindergartens, daycares. And every time we get more guidance or learn more, have better tips, we put it on there. So I think it's very important in Ohio that we all go to the same information and all work from the same playbook. What are some of these things you can do? If you have a little prepper side in you, or just do what a lot of us do. I grew up in Northeast Ohio, and I kept in my car my blanket and my flashlight and my kit of things. What would your kit look like for coronavirus? So what you would think about is, what would it be like if you got sick and you didn't want to go to CVS because you don't want to expose other people? So you want to now, just make sure you have your basic cold symptom, kind of flu, aspirin, NyQuil, if that's your comfort measure of choice, whatever that is, you want to have those medicines. But more importantly, you might want to have whatever your regular medicines are. A 14-day at least supply at home. You'd want to have some food. You might want to think about your pets and make sure you've stocked up on pet food in case you're all of a sudden getting the vacation quarantine experience. And you might also want to think about your kids. A lot of us have kids, and your kid might get sick and be sent home from school. So you want to be thinking about what your plans will be in that case. Also think about your parents or your grandparents. Will they need extra help, and what you might do? So if you're hearing what I'm saying that you would do a lot of the things you would do worrying about your loved ones getting the flu and having backup plans. Again, information is just so important. You will work with your provider. You will work with someone from the local health department who will be giving you guidance and calling in on checking on you, so you won't be alone. That's the other thing. You will have more help than you've ever had when you got sick if you get coronavirus. Eventually, what else will we see here in Ohio? I prepare for the worst, so I'm going to share a little of my, what I think about and what I see coming and what my colleagues are really planning for around the country. We will see shortages of some of the preparedness, the PPE, what we use, the masks, the N95 masks, the gowns. There are worries about that already. We have a stockpile in Ohio that when they implemented twice a day, 20-second hand washing in schools and wiping down surfaces, because this virus is easily killed by just routine cleaning products, there were 50% less cases transmitted. It was that less transmission. So it actually is something that works. What we're trying to do is just not get each other sick. Our citizens have been great. The people of quarantine have willingly done so, and that's what we'll need too. We do things if we need to quarantine places, and if we ever did need to give orders about a school closing or a public place, we would do it, and you would see all that coming gradually.
And that's Dr. Amy Acton, head of the Ohio Department of Health, and Governor DeWine giving the people of the state an update on the coronavirus. Thanks so much for joining us this morning. I'm Mark Neuse.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.